We're a large private practice cardiology group here in the capital region of New York State. We have about 35 cardiologists and about 25 advanced practitioners at present. We see about 90,000 unique patients per year and about 180,000 patient visits on an annual basis, both inpatients and outpatients. When I see a patient in the office who has a chronic disease process, atrial fibrillation, hypertension, heart failure, coronary disease, I look to see if I think those patients would benefit from being checked on.
Capital Cardiology decided to implement remote patient monitoring and principal care management because we have patient population that would benefit from continuous care, especially those patients that have obesity or heart disease.
Every provider recognizes that there are these gaps between visits where we are blind to what's going on with the patients. I think PCM and RPM help bridge that gap.
It gives us the ability to manage them when they're not in the office, see how they're doing at home with their blood pressures, any questions that they have, any medication issues that they're having. We're able to intervene with their chronic conditions in a more timely manner rather than waiting for them to come to the office.
When I am choosing a partner or Capital Cardiology is choosing a program or want to implement something, I'm going to pick the right partner. I'm going to pick the partner that is going to come along the side of Capital Cardiology, that shares the same beliefs and visions in providing the best outcomes for our patient. With our partnership with HealthSnap, we have been able to operationalize our staff resources more efficiently.
They provided us with the credentialed nursing staff that we need here in New York State to be able to provide this service. This took from us as a business the HR, hiring, monitoring, credentialing away from us having to do it and on to HealthSnap, which has been very beneficial to us because we scaled up very quickly into RPM and PCM.
We now are working with a company that is an extension of Capital Cardiology. So when the patients are calling and the patients have a concern, they have a care navigator that is working right along the side of us, triaging these patients, finding out what's going on, and actually knows these patients very well.
Before this, once a year you show up and if your blood pressure is off the wall, they give you another pill. Now, we have somebody monitoring. The navigator calls once a month. We go over various statistics, but the navigator is more than that. You go over and you set up a plan. There's no negative talk. If you missed something or you didn't go to the gym or you had something wrong, we talk about how we could correct it.
Once a provider decides that they need to enroll a patient into the PCM or RPM program, they provide the order for that. And then the order goes to the HealthSnap team, and they do a really great job in reaching out to the patient.
They are in constant communication with our nursing staff, letting us know what's going on with our patients. Our nursing staff then may raise that to the level of myself or an advanced practitioner to say, you know what, over the last 30 days, the patient's blood pressure has not been controlled, and they need an adjustment of their medications. Or Mrs. So-and-so's weight is up by 2 to 5 pounds, and I know this patient has heart failure, and how do I want to intervene on that?
Some patients with chronic conditions have a lack of education and insight into their disease process, and they can't quite manage it without having a doctor's say. So having that ability to talk to a nurse readily and give them that education that they need to be able to make the right choices for their health. And sometimes it's dietary, sometimes it's taking your medications at certain times through the day. To be able to just get a nurse on the phone and go over that at any given time is really invaluable to our patients, and it helps us as a practice be able to manage those chronic conditions a lot easier.
My wife and I travel a lot. Before I was in this program, as I was getting into my late 60s, and I started to wonder, am I all right? And I'm going across the ocean. I think I have more peace of mind now knowing that, okay, you know, I'm doing all right. So at this stage in my life, yes, it gives me lots of peace of mind.